Hi, Dr. McCarthy here, and I want to welcome you to Neuropathy Success Secret number 9. Today we're going to talk about brain function. And the brain is the master system of the body, the central nervous system, the brain and the spinal cord. And off of your brain and your spinal cord come all of your peripheral nerves. And the peripheral nerves are the ones that go down into your feet and the ones that come down into your hands. And these are the nerves that are typically affected with peripheral neuropathy. But they're all controlled and coordinated by brain. So to have proper brain function, you've got to have a couple of different things going on. We talked about some of this in a previous video, proper fuel. Your nerves need proper fuel, oxygen and glucose. Glucose meaning the blood sugar, we need to make sure that that's in the normal range, and oxygen, you need to make sure that there's no oxygen delivery issues like anemia. So let's say you've got anemia and blood sugar issues. That is a recipe for disaster for proper nerve function. So we've got to check the fuel. Secondly is activation. Activation comes from movement and exercise and things that we do here in our office, and we'll go over that in more detail. Two of the treatments that we use when someone's got neuropathy and we need to improve their fuel delivery to their nerves and we need to activate the nerves, for fuel delivery we'll use something that's called exercise with oxygen therapy. So we need to work on somebody metabolically to make sure their blood sugar is improved, anemia is improved, and then we give them oxygen therapy. And this works to get the oxygen to the tissues that need it, in this case the hands and the feet. But at the same time we do what's called brain-based therapies. Different therapies that are aimed to activate the brain. So you see, all at the same time we're delivering some improved fuel and activating the brain. So if there's issues with the brain, central nervous system, peripheral nervous system, that's playing a role in your peripheral neuropathy, and chances are there are issues there, this is the only way you're going to get it fixed. There's no other office around that does this exercise with oxygen therapy and brain-based therapy. Another thing that's real important is a neurotransmitter called serotonin. And the serotonin has a dramatic impact in your brain, specifically in the hypothalamus, your paraventricular nucleus. And if you've got issues with serotonin, then that could in fact be playing a role in what's going on in your hands and your feet. Now, all too often people are just prescribed medications. Take the SSRIs, the selective serotonin reuptake inhibitors, and they have their place. There's no doubt about it. They have a place. But it's a lot smaller place than the place that they have in our society nowadays. In fact, you've got to find out what you need to do to enhance serotonin production. If you have issues with any of these things, you need to call my office now. Thank you.